I'm Dr. Harikiran, a board certified plastic surgeon and hair transplant surgeon. Today I'm going to discuss one of the most commonly asked questions, what is the cost of FUE? In the past few videos I've discussed the reasons for which varies the cost of the FUE. But still, it's the most commonly searched word, so I would like to throw some more light on this particular area. The cost, as we discussed, it all depends on the quality, the surgeon's expertise, and the conditions that they're doing, whether it's a certified center or not, and with how many technicians are involved, is the doctor alone doing, and somebody claiming that the doctor is doing the whole procedure, it's quite impossible because it's all 8 to 9 hours procedure to do 3,500, 4,000 grafts for the stage 5, stage 6 boiling. So it is not possible for a one man to do all the thing, but there should be a doctor involved in the team. There are certain people who's done the plain technicians alone are doing the procedure. The problem is, when there's no doctor supervision, you can't give the right direction. They just pull out the grafts and put in the grafts. It's just not just pulling the grafts and putting the grafts. It is about the placement, the density, whether the requirement, all these things matters. Because we need to understand the type of bonding he has and type of grafts required. Sometimes people overdo it. Even if you don't require, and if your technician is assessing your bonding, so probably they end up doing the transplant which is totally not necessary. So the cost of transplant, you should you should talk to your surgeon whether it really requires your transplant, because sometimes you can just get away with a minoxidil, maybe finasteride and some PRPs in the early stages, especially stage 1, stage 2, and generalized thinning, and you end up just taking the medication alone. You don't require transplant at all. So when you actually decide on the cost, whether you take a consultation with the doctor, dermatologist, or plastic surgeon, or board certified hair surgeon, and get a clear opinion that actually you require a procedure. So you're going to save the whole cost of the procedure you're doing for unnecessary reason. So because for not everything, hair transplant is not a solution for every hair loss. So that is very important. So only for male pattern hair loss, which is in advanced stages from stage 3 and stage 4. Maybe stage 2 also, sometimes we can do for the advanced hair restoration. And the women, it is on stage 2, stage 3 female pattern hair loss. So this is recommended. Sometimes we even, for the reduction of the hairline, especially in the women, we do that. So it is very essential to decide whether actually you require the transplant or not. The costing depends on the grafts. Last time you said no, it's a number of grafts. So you need to decide how much, based on your baldness, stage of the baldness, you need to decide how much grafts actually you require. So based on that, we will be given a pricing from, let's say, 35 to 40 rupees to 60, 70 rupees. Sometimes people give packages. So you should ask whether the package includes your GST, because this hair transplant comes into aesthetic procedure. So GST is included in this. So which is 18% of GST in India right now. The cost of the hair transplant are decided sometimes based on the extent of the body, because sometimes the donor area is not sufficient from the scalp. So we end up taking beard hair, body hair, so which is going to take a lot of time, because beard hair extraction, body hair extraction need to be done little slow, because the area is different, the angulation of the hair is different, and for which the time factors, because some people say unlimited hair transplant. Don't believe all those things saying unlimited. Unlimited is no way, because you need to have the right donor area and the quality of the hair. If you don't have those and somebody is saying unlimited can end in 1,000 grafts, 2,000 grafts, because your donor may not support more than that. So unlimited is kind of, it's a very vague. You try to ask your surgeon or dermatologist and how much, at least the fair amount of the number you can ask. You can ask a range, but it could be 2,500 to 3,000 or 4,000 to 4,500. If you have a good donor on the scalp, then probably people can reach higher numbers. If you don't have a good donor on the scalp, probably you may have to take a beard and chest, which will influence the cost of the hair transplant. Safety is very important. Just don't get lured away with the cost alone. Look for the safety. Ask for the assurance. Ask for the quality. Just don't get attracted for the cheap transplant, because sometimes you end up having a disaster, because sometimes a one-time procedure. You can do 2 times, but the first chance is the best chance. Instead of cost, along with the cost, look for the reliability, safety, and trustworthiness. This is very important.